Good afternoon, everyone. Welcome to the study session for June 21st. And Christine, I think you are first up on our list.
Perfect. Yeah, I told my colleagues that are trailing behind me that I would be timely, so this works well. I'm going to go ahead and share my screen. If you have troubles hearing me, please let me know. So we have a brief COVID update for you, which includes some pretty exciting news about our vaccinations for the youngest members of our community. There's been a lot of movement on that in the last 72 hours. So we will have a quick update about that when I finish a little bit of a data presentation. So our epi update for the state of Colorado, as reported on the Wednesday director's update, cases continue to increase, although Jefferson County has reached a sustained plateau, which is positive news. We're in line with the rest of the state. We are seeing the hospitalization numbers across the state increase. However, they are, as they have been, not continuing to increase at the same rate as our overall case count. And then please remember, as always, that the cases that are being reported on these data slides are cases that are reported through the electronic lab reporting system and do not include home tests that people are taking at home, such as the rapid antigen tests. We are continuing to see Omicron, 100% of the circulating variants in the state of Colorado, both in terms of variant testing among positive cases, along with our wastewater data testing, are showing that 100% of the circulating virus is the Omicron lineage of the SARS-CoV-2 virus. Among that, we are seeing well over half being the BA2.1.2.1. This variant of Omicron, I will call it the current culprit for the surge that we are currently in. We are also seeing the BA4 and BA5 variants of Omicron. Those are the two variants that I mentioned probably in May that we were seeing in South Africa and our partners over in the European nation. We are seeing those now within the state of Colorado, in addition to Jefferson County. We are seeing a weird trend is that we're watching is that the state of Colorado, among our partners in Region 8, FEMA Region 8, as well as across the nation, we have a slightly higher percentage of the BA4 variant than other states. Nothing to be concerned about, just something that the EPI team is watching both at the state level and here in Jefferson County. So Colorado's trend over timeline, as you can see, we are definitely in a wave across the state of Colorado. Will likely peak near a similar height that our Delta variant gave us here, although our hospitalization data is significantly lower than it was during the height of the Delta wave and then, of course, the Omicron wave. Many reasons for that. One, we had a high number of infections with the Omicron variant over the winter, meaning that a lot of our population has current immunity to Omicron, as well as better availability of treatments and therapeutics to keep individuals out of the hospital in terms of the oral antivirals that were mentioned last month, excuse me. This is a statewide picture of where case counts are in general across the state of Colorado. Jefferson County is right here in yellow at the middle of the state. You can start to see that we are getting a handful of our less than 100 counties and even some that are 0 to 35 cases per 100,000 showing up. Our partners in Pitkin County and down in San Juan, it's not unexpected that they are in this red level. When there is a surge, the populations of those counties are so small that any number of cases will cause a large increase in their rate. So they do have a high rate of disease, but I wouldn't be so concerned about the color of those counties. Closer to home within Jefferson County, this is data that is available on our website. As always, we are continuing to maintain that data, and we are not intending to make a shift anytime super soon as to what we are doing with that, especially leading into, I know we're at the beginning of summer. Today is our summer solstice, but leading into respiratory season for the next year, we will continue to maintain some level of data tracking. We are at 0.78 hospitalizations, a little bit higher than the last time I came to you and reported data. Our case count from last Thursday is at 248.7 per 100,000. So we are above the 200 mark. If you recall my presentation from last month, we talked about the CDC community levels and that they are using this dividing mark of 200 cases per 100,000 to kind of distinguish between their CDC community levels. Our test positivity has dropped a little bit. I'm quite hopeful that when we get our data for this week updated on the website on Thursday afternoon, that this test positivity rate will continue to decline along with our case counts. As I said, this state has some geographic mapping that they've done, and they've shown that Jefferson County is in a sustained plateau. So I am hopeful that we will have reached the peak of our surge in Jefferson County, and we will start our decline over the next couple of weeks. This is the Jefferson County trend over timeline, very similar to what you were seeing across the state. As you can see, we are in a slight downward trend, which is why the state has put us at that sustained plateau. Because of the lower case counts, there is the possibility to see some variability in that trend line. And so some of this up and down up in here is what you are seeing. Hospitalizations, steady. We had a little climb there, and then we're back on the decline. Overall, I'd say we were on a slight decrease of our hospitalization rate. But as I mentioned earlier, we are not at the level of hospitalizations that we saw earlier for a number of reasons. Very much like our layered mitigation approach, we have a layered therapeutic and prevention approach now as well with COVID. We've had 0 weeks with no deaths reported in Jefferson County. This is really great news in terms of those severe impacts on our population. Remember that the data in the gold bar here at the very end is lagging by about 30 days. I'm hopeful that we will have very minimal deaths reported in these earlier weeks within this gold bar. The slight increase right here is not unexpected, considering we are in a surge of cases within the county. So we'll continue to watch this data, but still positive news in terms of the overall future of COVID-19 within the Jefferson County community, across the nation, across the globe. This graph, I'm going to expand it a little bit. I recognize it's probably pretty tiny on your screen. This shows where Jefferson County is in terms of case counts across the state of Colorado. So we are right here where that red arrow is pointing at the bottom of the upper third, I would say, among our community partners, but very much in line with the rest of the Denver metro area. You have Denver up here at 326, 28 cases per 100,000. Our partners in Adams County right above us. So the metro area is very reflective of each, what we are seeing. And then across the state, we're, at the bottom of that upper third. All right. Shrink that back down a little bit. This is where we are with the CDC community level. This is information that you likely saw coming out from JCPH last week. we messaged the community that we had reached CDC community level high. This is due in part to both our increased case counts, as well as the overall number of new hospital admissions, the 7-day total per 100,000 across the metro area. So the statistic that the CDC is using involves a health administration area, a health service area. So it is a reflection of the overall burden on the hospital system that our residents use. We know that our residents within Jefferson County do not just get admitted into our 2 Jefferson County hospitals. They are admitted across the metro region. And so this hospitalization number, while the data that I showed you from Jefferson County showed that we were at 0.7 per 100,000 or 0.79, if you look at the CDC community level data, it shows that we are, the last time I saw, we were at 13.4 per 100,000. I have not looked today, so that was the last time I looked. Because the burden on the hospitals within our region has increased, and the rate of disease is above 200 per 100,000, the CDC community level that we are put in is high. This CDC community level is different than the metrics that our hospital partners need to have been using. They have their own CDC metrics that they are utilizing. These are metrics that we ask our community members to utilize so that they can make decisions on which mitigation measures should be utilized for their personal situation. At the CDC community level high, masking is strongly recommended in indoor settings and in crowded outdoor settings. And crowded outdoor settings, there's a great site on the CDC website that talks about large sporting events, large outdoor concerts, large family reunions, really using a big gathering of people. If I'm having a barbecue in my backyard with my neighbors, we're all vaccinated, there's not a lot of people, masking is not necessarily recommended in those situations unless someone is at high risk. And that's where we want our community to take pause and think about those that they're interacting with and those who they may be visiting within the next 10 to 14 days. Incubation period has not changed for COVID-19. So an exposure you have this week could impact your 4th of July celebrations. So keep that in mind as you're moving about the community and doing the work that you are doing. And our super exciting news out of our clinic services, as well as across the nation, we are very excited to announce that the COVID-19 vaccine has been approved for individuals aged 6 months to 5 years. So this expands the availability of vaccine to the youngest members of our community. We know that we have several parents who are very excited to have this option available for their families. And for JCPH, our clinic will begin distributing that COVID-19 vaccine starting tomorrow. Appointments are available and strongly encouraged, but they are not required. I had an opportunity to stop by and talk with our immunization lead, and that was direct from her. So we are hopeful that they will be very busy tomorrow giving vaccinations to our youngest community members. And that is the extent of my presentation. I'm happy to take any questions.
Thank you, Christine. Board, any questions for Christine?
No, for me, Len. Thank you.
Harriet, go ahead.
Christine, are vaccinations for others also available at that clinic? And is that also that a appointment is recommended but not required?
That is the exactly perfect message, Harriet. Yeah, we have vaccine available for the whole of our community who are now eligible. Appointments are available if you want to guarantee a spot, but they are not required if you have a moment to pop in and get that vaccine or booster dose. We have can provide the booster doses as well.
Great, thank you.
Yeah.
Christine, are you anticipating any specific recommendations that the school might be doing in addition to us for kids as they start to come back, to make sure kids are vaccinated?
Yeah, so our school partners continue to share the recommendations of the health department in their messaging. They have not crafted their large back to school communication blast yet. I do have a meeting with the leadership of the Health Services Division tomorrow. So we will start to have the conversation about testing and ongoing outbreak response for what is coming in the fall. We know there will be outbreak response, as well as what recommendations will be shared for vaccinations for both their early childhood education programs all the way through their seniors in high school.
Thank you, Christine.
Yeah.
All right, I think up next we have health communications. Noella, are you with us?
I am. Nikki's going to pull up the presentation. So this is going to be kind of like a tag team for all of us. And so we'll get started as soon as Nikki can pull it up.
Thank you.
Is it up okay?
Let's see.
Okay. Thanks.
Awesome. So I can go ahead and get started. Actually, my computer just froze. There we go. So I want to start thanking everybody for having us today. We know it's been more than 2 years since our last update. I believe our last update was in late 2019. So we wanted to take a moment to introduce our team, our efforts, and highlight some of the milestones and challenges we faced since we last presented. I know there has been a lot of changes in the last few years. So we wanted to start just with an update of who makes up our comms team. You'll see some familiar faces on the screen, but we have had a lot of staff changes. Ending 2021, we anticipated having a team of 5, but just due to budget limitations and not hiring for our vacancy we will be moving forward with a small but mighty team of 4. I'll go first and introduce myself, and then I'll let the others introduce themselves. I'm Noella Rios. I am the Public Affairs Manager. I've been with JCPH for about 6.5 years. My role focuses on project and performance management, rapid and emergency preparedness response, and I also have expertise in graphic design and videography.
Hello, board. My name is Nikki Wellander. I'm back. I think the last time I spoke with you guys, I was saying goodbye, but I'm happy to be here for the long haul. I'm our senior media specialist, and I've been here for, not counting my brief hiatus, about 5.5 years.
Hi, I'm Hope Kadlachuk. I've been here a little over 2 years. My first day was March 30th, 2020. That's it. That's the end of the year. So it's been a fun couple of years. Now I'm a public affairs coordinator, and excited to be speaking with you all today.
Hi, I'm Kirsten Sarbury. I am the newest on the team. I've only been here for about 6 months, and I kind of support the team with whatever they need, and I'm also a public affairs coordinator.
Thank you, Nikki. So we can go ahead and start with just an explanation. Obviously, you guys know what we do, but just a little refresher. Our health communication team really strives to be a full service, innovative team that can drive meaningful change. We do this by creating and providing accurate, timely, engaging, and informative messaging about JCPH and general public health topics. We do this not only for the Jeffco community, but also our JCPH staff, as well as numerous partner organizations across Jeffco and the region. The purpose statement of the health communications team is to effectively educate, inform, and engage the community about JCPH programs, important public health messages by leveraging high quality communications and creative services. As I mentioned previously, our team really prides ourselves in being a full service innovative team. This means we've been able to produce a large majority of our communications in-house, including public and media relations, graphic design, videography, photography, digital services, and more. And this is all because of the strong talent and expertise that we have on our team. Being a full service team has allowed us to create many large scale projects without needing to contract out any other marketing service. This includes large scale marketing campaigns for not only JCPH, but also the Denver metro region. And we'll talk a little bit more about the campaign specifically, what we worked on during the last few years throughout the pandemic later in the presentation.
Okay, so I'm going to jump on in. Like I said, I'm Kirsten, I'm a public affairs coordinator, and I'll be talking about the recap of COVID-19 and what we've done. So throughout the pandemic, the health comms team has created policies for public, partner, and internal communications related to the pandemic. Additionally, we worked closely with our partners and internal emergency response staff to create processes for rolling out policies and public health orders. Some significant numbers to look at are that we released over 85 news releases and statements. We completed 7 communication campaigns and toolkits. We created over 25 website pages for the public with information regarding just COVID-19. There were over 700 unique news stories involving JCPH. And finally, we hosted or co-hosted 8 public town hall meetings. So I'm going to go over some of the campaigns that we have been able to complete over the last couple of years. So for the Together We Go Forward campaign, we work to promote prevention steps and community agencies to help slow the spread of COVID-19. This included input and participation from community partners. One of them was community or comunidad, sorry if I said that incorrectly. It included several county and community partners and was geared to bring together available community-wide resource information under one easy-to-access hub. Our campaign, You Can Be the Reason, was an effort to help increase vaccination rates among youth and young adults aged 16 to 29. This group showed a lower vaccination rate and was more hesitant than other groups. This campaign was extensively researched with the target audience. It used literature reviews, surveys, and focus groups. Yo Me Vakuma, again, I apologize for saying this incorrectly, created at the same time as the Be the Reason campaign, was used to address barriers, motivators, and vaccine hesitancy within the Latinx community. COVID-19 vaccines help kids be kids was a collaborative effort across local public health agencies in the metro area. This campaign focused on the pediatric vaccine and helped address parents' concerns and connect them with useful resources. And in addition to our campaigns, we work directly with local businesses to provide signage and resources for masking and prevention steps. And we also disseminated materials and talking points for schools, parents, and organizations around student athlete vaccination. Okay, so our digital and social growth. At the beginning of the pandemic, our team saw our social media channels grow rapidly. As of June 12th of this month, we have more than 11,000 followers on Facebook and more than 8,000 on Twitter. These numbers are more than double pre-pandemic. Additionally, website visits skyrocketed during the pandemic. Pre-pandemic, we would see 10 to 12,000 visits to the site per month. However, in 2020 and 2021, the website saw more than 1.4 million visits, which is more than 10 times more than before the pandemic. While this growth presented opportunities for JCPH to reach more people in our community, it also came with some challenges. Followers of our page became more vocal on our post, both in support and opposition of JCPH and public health measures. Additionally, we also have seen a marked increase in sharing of misinformation on our social media pages.
All right, sorry, forgive me. Running slides and a mute button might be might be my max capacity here. So before we start talking a little bit about the things that we're working on now and the things we're hoping to do moving forward, I want to go over some of our big accomplishments and milestones we've had in the last couple of years, even amidst all of the changes we've had on our team. And most of what we're going to be talking about in this section is outside of COVID. So it's pretty exciting that even though the majority of our team's resources and efforts have been dedicated to COVID-19 response for the last couple of years, we've still been able to have some pretty significant accomplishments and things that we can point to in the rest of the public health world. Maybe. Sorry. So first, we've talked about this briefly with y'all before in previous years, and I know that you've had updates on this from our division director, but we were really excited to host our 2021 Public Health Champions Awards back in April. We host this event every single year for our partners in our community who may not have their jobs be fully in public health, but they still make an important impact to public health. We were really excited this year to be able to recognize a number of groups around our community as our public health champions who were not only involved in the COVID-19 response, but were really integral in helping our community in other areas through it. It was a really successful event and we're super excited to continue it moving forward. We've had some significant lessons learned in the last couple of years, transitioning this to a virtual event. And we're hoping that in 2022, we are able, or in 2023, celebrating 2022, we're able to celebrate our champions in person and really recognize the amazing work that they've done. Also in April, we released our 2021 report to the community. What was really exciting about this is rather than it just being a recap of everything we've done for the last couple of years and really focusing on the COVID-19 efforts that people recognize us for at this point, we were able to talk about all the other incredible things that happen at the public health department and within the community. Public health so frequently operates in the background and you don't hear about us unless something happens. So it's really exciting for us to be able to reintroduce ourselves to a community that now we're synonymous with COVID-19 response. And importantly so, I think our teams have done some really incredible work on COVID-19, but there's also been a lot of work happening in the background on many other public health topics that we were really excited to get to showcase in our annual report this year. We've also been really involved in other communicable disease control efforts outside of COVID-19, of course, while still being very involved in the response and monitoring of the pandemic. We've been able to work really closely with the Emergency Preparedness and Infectious Disease Division on some emergent concerns in our community. We were able to distribute timely information about a potential hepatitis A outbreak in our community earlier this year, and we were able to do that really quickly and streamlined, and it helped us make sure that everyone in the community had access to whatever preventive steps they needed to take and information to understand if they had been exposed. We've also been able to work really closely with our emergency preparedness team here at JCPH and with the team at the Colorado Department of Public Health and Environment on situational awareness around monkeypox. We want to make sure that if the time comes and we need to do more communication around it, we have an appropriate plan in place, and we've been able to really use the lessons learned through COVID to make that effort underway. We also have continued communication and all of our public notifications around animal-borne diseases that we see every year in our community. We have had a number of rabies cases so far this year, and we've been able to do timely notification to our communities and with our community partners. And just today, we were able to put out a notice around avian influenza so that anyone who has poultry in the Jeffco community or who may be in contact with wild birds that have been exposed to this or any dead birds that they may come across, they have the information that they need to be able to appropriately respond. And this is just a couple of those efforts that we've done. Trying here, sorry. We'll do it manually. So we've also been really lucky to be able to present at conferences and in trainings in the last couple of years. Last year, our team presented at Public Health in the Rockies, and we had both a session and a poster. The session that we did, we were able to do in tandem with our other communications partners at LPHAs across the metro area. And this was really, really special and significant to us because before the pandemic started, we created a communications collaborative with these other LPHAs so that we could make sure all of our messaging was in line and was really taking into account the fact that people's lives don't stop at county borders. So what they're hearing in Denver, what they're hearing in Boulder, or even what they're hearing down in El Paso County should really be cohesive and strong and true public health messaging. So we were able to work really closely with all of these other partners before the pandemic, which then allowed us to have more strong partnership and collaboration during the pandemic. You saw that COVID-19 vaccines help kids be kids campaign it's a direct result of this collaboration that we've had across the region. We were able to work really closely with other departments and create a campaign that went out across the state that was really, really impactful and made sure everyone was getting important, accurate, and streamlined information. The posters that we presented, we actually got to present 2 posters side by side, which was really special because of the campaign we were promoting. We trans-created a campaign, which means we created it simultaneously in English and Spanish to be responsive to the needs of that community, not just be in 2 different languages. So we did quite a bit of research with young women in our community around what sexual health messages they were going to need. And we were able to create those messages specifically for English speakers and for Spanish speakers. So we then trans-created 2 posters to present on this and presented on it in both English and Spanish at the conference. And I will also make sure you have links to these posters and to some of these sessions that we're going to be talking about. I was a panelist on a national webinar hosted by the Rockefeller Foundation, and this was in March. It was really exciting to get to speak with other communications professionals about lessons learned throughout the pandemic and the ways that we can take all of the things that we've learned in the last 2 years and before to create really robust and meaningful partnerships with the media in our community to get the best information to the public. And then our team is always looking for the next opportunities to make sure that we are communicating with other public health professionals and with our community well about the things that we're doing. We know that we've had a lot of lessons learned out of the campaign research we did around COVID, and we're looking for opportunities to share that moving forward. Here's just a couple pictures of us. This was the top left is us at the Public Health in the Rockies campaign with our posters. Or Public Health in the Rockies conference, sorry. And then the bottom right is a screenshot from the webinar that I did. Oh, sorry, I'm going the wrong way now. They trusted me to run the slides and they shouldn't have.
All right, thank you, Nikki. So now we're going to go over basically all of the work that we do that isn't as tied to COVID and is just among our day-to-day communication efforts. So some of the major things we have going on that's more the high level things is balancing the rapid response needs and ongoing education of public health topics. So some examples of that is the rollout of newly updated programs such as NICU to Home and Text for Sex Facts, communications and promotions around upcoming on-site wastewater treatment system regulation changes, an in-house video that we're creating promoting WIC and explaining allowable foods to clients, working with a contractor to ensure our website is fully ADA compliant and accessible for all members of our community, and then continual efforts to plan and ramp up streamline harm reduction communication. So that's with our Points West team. And then just additional efforts around the baby formula shortage, air quality, HIV testing day, and more. And all of these are examples of how much work that we do in-house, creating a video, redoing our website to make it ADA compliant. And so just really cool projects that we get to be working on that are really, one, the work because of the other incredible people we work with at JCPH, and also work that's just really going to impact our community members in Jeffco. So we're also working on our communications plan for 2022 through 2023. just to continue to see how we can be better, what areas do we want to be focusing on, and how can we continue to work at amplifying what public health is and does. And so moving forward, we are going to be under the Emergency Preparedness and Infectious Disease Division at JCPH with our good friend Christine Billings that you all know. And so although we will be in that division, similar to the division that we were in before, we will continue to be supporting the entire department and helping any team, whether they fall in our division or not, with communication services and ongoing rapid response needs. One of our biggest priorities moving forward, we want to continue to remind people what the public health and JCPH story is. So we are not just the COVID people, we do so much more work and really help our community be a safer place and amplify the work that other teams that aren't related to COVID are doing as well. So as we do that, continue to move into more of our pre-pandemic efforts, including internal efforts such as being on task forces and support larger internal JCPH efforts. Due to our limited capacity over the last years, there just hasn't been as much of a role from our team in those efforts. So we're excited to step back into that and excited for just the continue developing and changes that our team is in, being in a new division and adjusting to new roles and new people on our team. So that's us. Questions, comments, concerns?
Well, thank you all. Definitely want to, again, thank you all for the work and then the collaboration across the department to highlight all the great work that's happening. Hilda, you had a question.
Thank you, Lynn. Well, before I pose my question/comment, I want to thank you. I have seen the wonderful job that you guys do, and I just have to say how wonderful has been to work with some of you, and seeing the product, seeing the results has been wonderful. So thank you and congratulations for the amazing job that you're doing. And I'm really happy to see in there your next steps is to talk about the health, the Jefferson or the public health history and the incredible work that people do. That is one of the comments that I was writing in here. Do you guys have any campaigns or something to kind of show to public how much caring is involved within the department? Because that is something that I've been able to appreciate from every single department, and I feel like people need to know that. So I'm really happy that you guys are creating a campaign on that. And my other question is, do you think it is possible, and I don't know if that falls within communication, to bring more public awareness to these meetings? I know we offer interpretation in Spanish, but to make it more intentional and to create more opportunities for people to feel that this is a meeting that they can attend. This is a meeting where they can feel they are included, and maybe even make it more language appropriate for the meeting. Do you think it's something that can be done on that area of really expanding the invitation for people to feel welcome, being language not being one of the barriers, but open it up to other languages, Spanish and other languages that are present in a county?
Yeah, definitely. One of the strategies that we have moving forward as we're building out of this overload on our social networks of COVID information is highlighting other programs and other services that we provide, and the Board of Health meetings is one of those. So really capitalizing on that huge following that we talked about within our social media channels. So making sure we're posting regularly, announcing prior to the Board of Health meeting, which would include information on the language services that we offer for the meeting, And then now there is like the sign up link that we worked with Lindsay on to make sure that is on the website as well. So we also are highlighting it in our community newsletter. We kind of worked a new transition in timelines so that the community newsletter goes out before the Board of Health meeting so that we're capitalizing on that audience as well. So
and are those efforts in other languages? I mean, because if we put language services available in English, people who doesn't speak English are not going to be able to understand it.
So for the community newsletter right now, it is just in English, but our social platforms, when we have something that we can link out to that could be Spanish language, or we have the resources to do that, we do in Spanish. So the Board of Health announcement on our social platforms will be in English and in Spanish. And they won't have to use a translate function on that.
Oh, okay, perfect. So what I'm hearing is that you already have this campaign.
It's just posts that we do organically on our channel. So we post on Facebook and Twitter. And we can also capitalize on our Nextdoor. Nextdoor we haven't done too much work on, mostly because it's just been COVID information, but I do think it would be a good platform to share this community meeting.
Perfect. Yeah, and like you say, capitalizing with some of the network organizations that are around the county that they can serve to promote this.
Exactly. We do meet monthly with Jeffco communicators. And so any kind of meetings we have on, we do highlight those kind of things. So if that communicators meeting is scheduled before our Board of Health, we'll say, this is coming up. Can you share with your networks as well? So we do have a few different channels, but to make sure it's in multiple languages, we capitalize mostly on our social platforms.
Okay, perfect. Thank you now.
I'm going to move us to our normal board meeting. We're a little bit past our normal start time, but thank you again all for the amazing work. And again, we look forward to talking to you again soon, sooner than 2 years. All right. Lindsay, if you would help me, we'll call our June 21st board meeting to order. If we can get a roll call.
Yes, Hilda Gerke.
Present.
Harriet Hall.
Here.
Kimberly Kropick.
Present.
Blaine Drager.
Present.
And for the record, Sherry John is absent and a quorum has been established.
Thank you. And I understand our support for language justice folks are here. Rosa, are you available?
Yes, I am. Hello, everyone. Good evening. Buenas tardes a todas, todos, y todes. So happy to be here tonight. My name is Rosa Guzman Snyder. I am here with the Community Language Cooperative, and we're here to open up a space for language justice. Estoy aquí con la Community Language Cooperative. Buenas tardes. Estamos aquí para proveer un espacio para la justicia del lenguaje. I'm going to be saying this message in both English and Spanish, so bear with me. Voy a estar diciendo este mensaje en inglés y en español, entonces aguántenme un tantito. In just a few minutes, we're going to be turning on the interpretation feature. On the bottom of your screen, you're going to see a little globe icon that looks like this, that says interpretation. You won't see it right now, you'll see it in just a few minutes. When we turn it on, we ask you to select English or Spanish, or off if you're fully bilingual. En unos minutitos van a ver un globo terráqueo que parece así, se parece así. En ese globo terráqueo van a poder escoger inglés, español, o off o apagado, que significa que son completamente bilingües y no necesitan interpretación esta noche. Please make sure that throughout your time today, that you speak at a conversational pace, because we are interpreting in real time. Asegúrense de por favor hablar a un paso conversacional porque estamos interpretando al mismo tiempo. This doesn't mean that we expect you to go a whole lot slower. Just make sure that it's conversational. No se quiere decir que queremos que vayan súper lentos, nada más a un paso conversacional. If you have text on the slides, we ask that you read the slide to make sure that it's accessible for folks. Si tienen texto escrito en las diapositivas, les pedimos que por favor lo lean para asegurarse que sea accesible para todos. And then please, if you're not speaking, just make sure that you mute yourself. Si no están hablando, por favor, apaguen su micrófono, just so that I can make sure that I'm interpreting everything that's being said, para que yo me asegure que estoy interpretando todo lo que se está diciendo. If you have any questions or anything, if you cannot hear for any reason, please just raise your hand or send a chat, and then we'll make sure to troubleshoot. Si por alguna razón no pueden escuchar o cualquier otra cosa sucede, por favor déjenme saber y levantando la mano o mandándome un chat y podemos arreglar el asunto con la interpretación. If we can, please go ahead and turn on interpretation. And I believe.
Rosa, you muted yourself.
I think interpretation is on now. We cannot hear her.
Thank you, Rosa. All right. Our first agenda item is the consent agenda. Are any issues with anything that needs to be pulled off of that? If not, Kimberly, go ahead.
I just had a question. Since I was not in attendance at the May Board of Health meeting, and one of the items on the consent agenda is the approval of that, how do I do that, since I don't know if those minutes are accurate or not? I'm assuming they are, but.
We can either pull that off or you can abstain from approving, either
Okay.
one, whichever your preference is.
Well, I'll abstain. It'll be faster. Okay, thanks.
There we go. Any other edits or things need to be pulled off? If not, I would entertain a motion to approve the consent agenda.
I would move to approve the consent agenda.
I second.
We have a motion and a second. Any additional discussion? All those in favor, say aye.
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 Those abstaining,
Me, aye.
and motion still passes. Thank you. Thank you, Kimberly, and thank you all. Our next agenda item is public comment. I think we do have a few people that had signed up for public comment. Lindsay, if you can help us facilitate getting those people, and you'll have 3 minutes to make comment, and then please wrap up so that we can get to the next person.
Okay, and the first person is Josh Schlossberg. And Josh, you should be able to unmute yourself.
Yep, give me 2 seconds. I kind of had to just jump into this. Okay, can you hear me all right?
Yes, we can.
Okay. Josh Schlossberg, I'm with Colorado COVID Watch. So we are launching a petition in July to demand that county commissioners remove Sherry John from the Board of Health for her many derelictions of duty throughout the pandemic, all uncovered in our 8-part report, Unmasking Jeffco, which is at coloradocovidwatch.org. All that's based on our Cora of Sherry John's emails. Some of the many reasons Jan has no place on any Board of Health. She's opposed to all mask mandates throughout the pandemic. She intentionally hid COVID data from public meetings. She spread disinformation, including that the quote, mental health impacts of wearing a mask are outweigh the actual health benefits, that the Omicron variant isn't putting people in the hospital. She's risked private and public health data by refusing cybersecurity training for many months. She impeded a police investigation into anti-vaccine death threats. She sidestepped and undermined the authority of former public health director, Dr. Dawn Comstock. We can probably also add that she doesn't seem to attend all Board of Health meetings as well. We'd still like a response from the board on these points and others that we've been sending you. And also we would like to know whether you're going to ask Jan to step down from her role as president, because her president, it makes a mockery of the Board of Health and Jefferson County as a whole. Thanks for listening.
Okay, next up is Heather McTammany. And Heather, you should be able to unmute.
Hi, can you hear me?
Yes, we can. Thank you.
Okay. Hi, my name is Heather McTammany. I live in Evergreen, and I'm a volunteer with Colorado COVID Watch. I looked at county data, and since January 28th, when you rescinded the mask mandate, not based on data, but based on a gut feeling that this pandemic would just magically go away because Sherry John's children have been infected with Omicron and quote unquote, we're fine, at least 117 Jefferson County residents have died of this preventable disease. Their lives are over. Since rescinding the mask mandate, another 25,000 positive cases have been reported to the county. Due to all the rapid at-home tests, that figure is underreported by a factor of somewhere between 7 and 30 times. Assuming underreported by only 5 times, that means 125,000 Jeffco residents have been infected with SARS-CoV-2 since the board led by Sherry John took away the last community protection. The CDC says 1 in 5 COVID cases results in long COVID. Therefore, in the past 5 months alone, Sherry John's Board of Health's inaction has contributed to the disabling, possibly permanently, of 25,000 more Jeffco residents. This is a breach of your duty to the public. Board members have a duty to nearly 600,000 Jeffco residents to, quote, make policies and decisions that will help promote health and prevent disease in the county. Instead, you're basing your decisions on gut feelings and ignoring data. You're gambling with the lives and health of your constituents, and you're losing. Reinfections are happening within 8 days. There is no lasting natural immunity. Reinfections are more severe. Reinfections are harming T cells. New variants are not milder. Everyone infected with COVID is at higher risk for heart problems, clots, inflammation, and arrhythmias. The bottom line is I do not feel safe with Sherry John presiding over this Board of Health during a pandemic. I believe she should be removed and replaced with someone who is willing and able to fulfill their duty to promote health and prevent disease in the county as multiple airborne viruses continue to spread unmitigated. Thank you.
Okay, next up is Bruce Strawn. And Bruce, you should be able to unmute. Bruce, if you're talking, you're still muted. We can hear you now, Bruce.
Hello, this is Bruce Strawn from Arvada. Earlier I heard that the COVID vaccines have been approved for kids as young as 6 months old, and that this is great news. I just looked at the graph on your website. It shows that kids age 5 to 11 are 3.3 times more likely to get COVID than kids who don't get a shot. Kids that get the booster have an outcome twice as bad as kids that only got 2 shots. Now, as you well know, the VAERS website from the United States government shows the COVID vaccines have had more adverse events than all other vaccines combined. Now, I recently did a QORA request to you people requesting why you have discontinued showing data before that showed the percent hospitalizations and deaths by vaccination status in this county. You are required by Colorado state law to provide those records. There are very few exceptions for withholding those records. This does not meet that definition. You are in blatant violation of state law. What are you hiding? What are you hiding? Well, it must be something pretty sinister if you're going to this great lengths, I mean, violating state law to refuse handing over records to a citizen in a legitimate request. We can see what you're hiding because it has the title of the graph, hospitalization status by vaccination status, one example. So you give me the title of the graph and the whole rest of it is blacked out. You gave me 30 pages of blacked out documents. Is that what you call transparency? Is this how you call rebuilding trust in the community? You're not above the law. The state law is what it is. You have no legitimate reason. You didn't provide any reason for the redactions. You provided no reason for the delay. And it was well beyond the timeline specified in state law. So that's about it. Do I have a time limit, or do we have a clock here?
You have 15 seconds left.
All right. What kind of a person thinks it's good news to give an experimental drug with known side effects that causes kids to get sick? What kind of a person wants to give
Your-
that to a 6-month-old kid?
your
Go
time's
look
up.
in the mirror. That's the kind of.
Okay, and that was all for public comment. Thanks, Lane.
Thank you, Lindsay, for assisting. Agenda back up. Salma, see your face. Welcome. And you are up next for financial report.
Thank you. Go ahead and share my screen. Can everyone see my screen? Okay.
Yes.
Awesome. So good evening, everyone. Today, I will be presenting the May financial statements. And as of this current reporting cycle, with 41% of the year complete, our total revenues are being reported at 37% of the annual budget, so below budget by 4%. Unfortunately, this is mainly due to our grant funding, as we are bringing less revenues than we had initially anticipated. However, I do want to highlight that this is mainly due to some scope limitations with one of our emergency response grants. And Christine and her team have been working extremely hard to figure out ways of increasing support to our community, providing additional resources, but using the current financial resources that are available to us now. In terms of expenditures, our salaries and benefits are below the prorated budget by 10%. There are various factors that play into this. One of them is what I mentioned with the ELC grant, and the rest is that we have a lot of vacant positions that we are currently in process of filling, and we also have vacant positions that we are not planning to fill. And unfortunately, this is due to some of the budget challenges that we are facing. We are going to face next year. So we're just really trying to plan ahead and figure out ways of really identifying those budget cuts that we need to make and not moving forward with some of the positions. Our supplies and direct assistant line items, we continue to surpass these line items significantly, but please note that this is because we've only budgeted minimal dollar amount under these line items. Charges for services are below the prorated spending by 9%. We expect this line to slightly increase in future months as we start to close our expenditure contracts with budget, with grant deadlines and things like that. Capital projects and equipments are being reported at 38% of the annual budget. Intergovernmental charges are reported at 37% of the annual charges, and interdepartmental charges, which is cost allocation or charges which are cost allocation charges, are being reported at 40%. So just a little bit below the prorated budget by 1%. Overall, that puts our total expenditures at 33% of the annual budget. And to date, the department utilized $2 million or 23% of county transfer. So that's all I have today, unless if board members have any questions.
Any questions for Salma from the board? I would entertain a motion to approve the financial statement for this month.
I move to approve the financial statement ending May 31st, 2022.
I will second that.
A motion and a second. Any additional discussion? All those in favor say aye.
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 Any opposed? Any abstaining? All right. Thank you so
Awesome.
much, Salma.
Thank you for your time today. Thank you.
All right, I think we have leadership updates next. Joe, you're listed first if you want to go first.
Actually, Lane, if you don't mind, if we can go back to new business. I believe budget discussion is on the agenda, unless I do not have the most recent agenda.
So that was actually taken off.
Oh, wonderful, even better. As far as an update from good afternoon, everybody. Administrative Services has a department. Let me touch on the budget very briefly. I did not have many details to include anyway. We are still in the midst of the process on how to incorporate the reduced county transfer for next year. This is obviously an ongoing process. Typically, we do a budget presentation in the month of June to the Board of Health. We are making sure that we move forward with the budget in the most impactful way, in a way that is the most supportive of our team, our staff, our programs, and our community outreach. So more details to come next month. Administrative Services at this point, I actually want to announce that within our team, we do have a promotion. I want to make sure that we bring attention to Georgia Archuleta, who has been promoted from the senior help desk support role to a junior systems administrator role. She's been with us for a few years and very much involved in a lot of the IT support systems that we provide to our team, but has really showed an eagerness, a willingness to take on more projects. I'm very happy to find an internal candidate for this position. This is a long overdue promotion, so I'm very excited that Georgia Archuleta has accepted that role. And I look forward to the progress and the additional support she will provide in that new position. Administrative Services has been within this department, been as level and as lean as we possibly can be. I think it goes without saying that this department is severely underfunded, that there is so much more work we can do that we should be doing. But behind that front line of support, or behind the front line of services that we provide, is our administrative staff, our IT team, our accounting team, our HR support. We continue to be lean despite the department growing. I just want to highlight that, with our employee of the month, being an IT staff member, that there's a lot of work that goes on behind the scenes in Administrative Services. And I just want to bring attention to a lot of that support that is provided. So that's all I have. Thank you, everyone.
Thank you, Joe.
Thanks, Joe.
And I do echo your support.
Thank you.
Elise, I think you're up next.
Good afternoon. I have a few things to share, and I will try to do this without getting emotional, but this is my last Board of Health meeting as a staff person, and I want to thank the board. I've been doing some reminiscing about my tenure here, and the Board of Health has always been a staunch supporter of the programs that were housed in the division, and really gave us the latitude and longitude to look at programs, what the community needed, commensurate budgets, just overwhelming support, enthusiasm, encouragement. So I just want to thank you and all the board members who preceded you for making all this possible for us. So that's so. So thank you. I do have some updates from each of the teams. You heard from Health Communications, and again, troopers, warriors, amazing folks. And I also wanted to say that Noella Rios was promoted internally to become the manager position. So we appreciate her leadership, her commitment, And Noella has really worked her way through starting at the front desk, working with Wic, etc. Her talents are just too numerous to go into. So congratulations to Noella. Our tobacco team is, even though they have some changes on the team that you'll probably hear about in the coming months, they're doing some amazing projects with supporting the commissioner's request to find out the temperature of residents in unincorporated Jefferson County regarding clean air, sales, prohibiting sales of tobacco, retail licensing. So they're doing a lot of informal conversations, and they're collecting data through town halls. So you may have gotten some invitations on that, but they really want to hear what folks have to say about these topics. They're also working on a campaign to assist youth with quitting vaping and tobacco use. It's very extensive. They're using movie theaters, they're doing social media, Facebook, and collecting a lot of informal data and formal data, quantitative data. They're working with National Jewish, and it's a campaign that's going in 3 counties. So again, looking at different populations' needs. They're working with Archway communities who are planning to go smoke and vapor free in January. So they're working with the tenants there to make sure that folks don't lose their housing because of continuing to smoke. So that's one of those unintended consequences of something that sounds really good about creating smoke-free residences and reducing smoke infiltration. And yet some people, because if they violate the new policy, could become homeless. So we have to work to work with folks on both sides of the issue. And then we just received the data from Healthy Kids Colorado survey that informs so much of our work with adolescents. And looks like some of the tobacco trends are going up. So again, I know you'll be getting a report on that about what the data tell us and how it will inform the programming that the tobacco team will be offering. Quickly moving on, I wanted to give you a baby formula update that Wic has expanded the types of brands, the sizes, and our staff have put together some handouts so the clients can see what is acceptable and allowable on Wic, which has been a great expansion of brands. So that's really a very positive response. And we have a new registered dietitian starting this month. Her name is Perla Madrid, and she was one of our interns. So again, we like to capitalize when we recognize talent. We want them to come join our teams. And you may have seen the event. There's going to be a grand mural gala the end of June 30th at the Edgewater Library. We have an amazing partnership with the libraries and policymakers and the public regarding CTC, the youth involvement, and working to recycle some of the banners that libraries have used. They're flipping them over, and the teens have created some amazing murals that will be displayed throughout the libraries. And it's a very exciting program, and they're going to have some photo voice presentations. So I did ask to make sure that Lindsay got that to you. And the Out for Safe Spaces program is getting started. So just a lot of great work. So again, thank you for your support.
Louise, thank you for your support, for all that you've done for this community, and you are going to be greatly missed, but you certainly deserve to be able to head off into the sunset. I'm very sorry I'm going to miss your going away. I'm not sorry I'm going to be on vacation, which I'm very glad to finally get one this summer. And unfortunately, it's coinciding with that, but I would love to catch up with you at some point afterwards too. But thank you so much for all you've done. You've been wonderful to work with. Anyone have questions or anything to share with Elise? Lots of hearts I see.
This is Kimberly, and Elise, I am lost for words at really kind of the bittersweetness of this. I'm so excited for what lies ahead for you. And I am certain we have not seen or heard the last from you, because I know how dedicated and passionate you are about public health. And I also want to just offer to you my heartfelt thanks for everything you have done, your role on the executive leadership group, as we're kind of going through this transition. You will be greatly missed, but the contributions you have given to the board or to the health department are far and deep, and we will feel your spirit in a lot of things in the days ahead. And I just wish you all the best, and I am going to try my best to get to your retirement goodbye. But like Lane, I'm in the process of getting ready for vacation too. So I will try my hardest. And if not, I'd love the opportunity for a cup of coffee later to firstly, thank you. So thanks.
Harriet, go ahead.
I'd like to chime in. Elise, I've known Elise for a number of years in my former role as a part of one of a Jefferson County organization. She commented on the Board of Health's staunch support of public health. I want to comment on Elise's staunch support of community collaboration, which is one of the values that I hold near and dear and always espoused and worked for. And Elise always did too. And so it was great to be involved, or at least have my organization involved in so many things that Elise was involved in as well, and supporting and pushing for. And I just want to say how much I appreciate your positive, upbeat approach to things. I'm kind of an optimist, and I think you are too. And so we see things that we want to have happen, and then we work hard to make them happen. And I think that's wonderful. So again, so as others have said, I will try my best to make it to your farewell, although I'm getting ready for several things, including surgery, but it's before that. So hopefully I will be there and limping away and say thank you and share a hug. So yes, thanks, Elise.
Well, I also want to chime in. I have the pleasure to meet Elise a couple months ago, and I am just very honored to have the opportunity to meet you and to see your bubbling personality and full of energy and full of passion. It's contagious, and I thank you for all the contributions. I wish you the best. I know, they say, this is probably not the last time that we hear from you, and I hope you keep joining us in these meetings, and best of luck. I will also try my best to be there to give you a hug and to appreciate you in person. Thank you.
Thank you again, Elise. All right. Jim, I think you're next.
Good afternoon, all. I have a couple of things to share with you this afternoon. First, most of you have worked with John Vickery. I am sad to announce that John has put in his resignation and will be leaving us July 1st. Mary Sloan will take on his responsibilities for Board of Health hearings. John and his wife are going off to seek greener pastures, and we're very pleased for him, but bummed for us. So I hope you'll all take an opportunity, if you have one, to wish him well in his departure. Secondly, I just want to give you a brief heads up of a pending action that's going to be happening in the Jeffco Lakewood community, proceeding an EPA rulemaking process that'll happen later this year regarding air emissions from medical sterilization facilities. We have a very large medical sterilization facility just a couple of blocks away from our building here called Terumo BCT. Terumo utilizes ethylene oxide as its medical sterilization chemical in their medical sterilization process. And EPA, over the last several years, some of you may recall that a few years ago, EPA released the National Air Toxics Assessment Report, and it named Terumo as a source of ethylene oxide, which is a carcinogen and a mutagen. And although they are in compliance with all of their CDPHE air pollution permits, and their emissions have been reduced substantially since the initial report came out, they still fall outside of the health risk, acceptable health risk levels for excess cancers. And so their EPA national headquarters, EPA Region 8, and CDPHE, which is the permitting agency for this facility, we'll be holding a public meeting. Sometime they'll be making an announcement very soon. We'll make sure you have that date if you're interested. But they will be holding a public meeting with aimed primarily at the community in which Terumo is located, and the surrounding community, to explain all about ethylene oxide, health effects, risk assessments that have been done, efforts that have been made by Terumo to improve their emissions situation, and then answer questions and make the community as aware as they can be, so that they have the opportunity to participate in the rulemaking process that will proceed later on this fall. I'm going to hit the enter button here, and maybe I was on the wrong screen. I will be inserting the links to a CDC website, an EPA website, and a CDPHE webpage that give a whole lot of detail about ethylene oxide, what's been done in the past, and the EPA's ongoing efforts to regulate emissions across the country from these types of facilities. So again, I just want to give you a heads up that this is a community, there's going to be a community meeting that'll be headed up by EPA Region 8, as well as CDPHE in the month of July or early August. They can kind of keep pushing things back, so I don't have a date for you at the moment. Just so you're aware, and that you have the ability to sit in and listen. Our role at JCPH as the local health department is to help facilitate the outreach and information sharing that CDPHE and the EPA are planning to do. Nikki Wellender, myself, and my air pollution team, Madison Pitts and Trenton Mitchell, have been attending meetings for the last couple of months on a regular basis with EPA and CDPHE to talk about communications and how to do effective outreach. The city of Lakewood is also heavily involved, Terumo being a large employer in the city of Lakewood. They have a strong interest in seeing what happens with this. But this rulemaking is not targeted at Terumo. There's no evidence that Terumo is creating a big or an excessive health risk in the community. But EPA and CDPHE really want to make this an open communication, very transparent process on its way to the EPA rulemaking. So let me see if that'll show up. Yep, there's 3 links on this on your chat box. You can copy those links and look at them at your leisure. We will follow up when we have more information, and when the EPA and CDPHE schedule their meetings, the meeting that's going to be held, we'll make sure that you have that information. And you'll have talking points in your hands and lots of information at your fingertips should you have questions from the general public. And certainly you can refer folks to us or call us directly if you have questions. And that's all I have today, Lane.
Thanks, Jim. I actually have one follow-up. I know the air toxics bill changed quite a bit in the legislative session, but did pass and was focused on looking at monitoring across the state for possibly facilities like this. Do you know if that's this would be an area where states expanded monitoring would occur to get a better sense of what's happening locally?
I'm not aware that they've cited or have even tentatively cited one of those monitoring stations for air toxics in this location. I think they have other sources they have an interest in.
Okay.
But and the fact that Terumo has done a significant amount of emissions reduction work over the last 3 years to try to reduce their not only their emissions, but also the risk levels that they represent to the community. So I'm not sure they'd see a whole lot above background levels at this point, because that's what they've seen in the most recent air sampling events that have been done.
Great, thank you. Anyone else have questions for Jim?
I do, Lynn. Jim, thank you for that information. And when I was listening to you, I'm wondering, I'm curious to see if the people they are living around that location, around where that business is established, are they informed of the potential air pollutants they are exposed to? And if they are, have they been involved or invited to some of these discussions?
Yes, back in 2018 was when this issue originally surfaced. It was due to a change in the risk levels that EPA assigns to this particular chemical, the concentrations. And so at that time, JCPH, along with CDPHE and the EPA, did outreach to the communities around it. We reached out to several census tracts, which were downwind of this facility. There's been extensive air quality modeling done around the emissions of ethylene oxide from this facility. And so they've modeled out the extent to which these chemicals have moved downwind of this facility. And they reached out specifically to those census tracts, some of which are actually considered disproportionately impacted communities. So they really are paying a lot of attention to trying to connect with those communities. We've been encouraging them to find a location. It sounds like they're going to do a virtual meeting, and we've been pushing back on that pretty hard, encouraging them to find a location somewhere close to that community. And we had the last go around, we had a meeting at the Boy Scout facility right down the street from us here. And it was, sparsely attended, but it was at least close to the neighborhood. We're still looking and pushing hard on EPA to try to have a public in-person meeting, although I think they're a little bit reluctant in light of COVID occurrence at the moment. So we'll see where that takes us, but we are really trying to push to get the information out in a format that makes it accessible to everyone, particularly those who may not have access to computers or sites that have computers to get that information to them.
Thank you so much, Jim. And I'm really glad to hear that you are aware of some of those barriers that kind of don't allow for people to participate actively, and also consider other potential barriers like access to language or like you mentioned, we assume that everybody has computer or internet, but that's not the case. So
We will
thank you for
definitely make
paying attention
sure,
to that.
we will make sure also that language justice is at least we will pursue language justice to as great an extent as EPA and CDPHE are willing to include in the public meeting. We believe heavily in the need for language justice in this particular situation, and those services should be made available to for this particular meeting.
Thank you, Jim. Appreciate it.
Thank you again, Jim. Carrie, you're up.
Hi, I'm Carrie Remersma, the Director of Community Health Family Services, and I have a few updates today. I think the most important update for family services that I want to highlight is that we will be integrating the Wic program into our division of family services. With Elise's departure, Wic is going to come and reside side by side with our current programs. I'm really excited about that. I'm really looking forward to working closely with Tatiana Dykes, the Wic director. I think that family services and the Wic program completely align in our many of the people in the community that we serve, but certainly all of our goals for healthy families in Jefferson County with access to good nutrition and multiple other resources that we can be a bridge to. So very much looking forward to that. And just so you know where Wic will be after Elise leaves. I just want to give another little update and a shout out to one of our public health nurses, Samantha Gibbs, has been working. She's the spearhead for liaison and an agreement we have with a nonprofit called We Cycle, WEE as in small, We Cycle, which provides needed infant baby items to families. And she has been working for doing child passenger safety and education and advocacy, and We Cycle will be able to provide new car seats for families in need. And Samantha Gibbs is setting up that education to be able to provide those for like our nurse home visitors who go out and see families. They will be able to bring new car seats where those are needed, along with partnering to make sure families have access to proper installation and inspection for those car seats. So making resources and education known to those families. So it's just one of the many things that we do with families, but we know that child passenger safety is super important. And we're working on some new protocols and we have some new resources for that. So I'm excited about that. I just wanted to let you know, last month I had mentioned that Sophie West, our child fatality review and injury and violence prevention coordinator, had been working to procure a number of gun safes and medication bags for safe storage of medication. And those have been received now. She partnered with a local retailer, Bristol Cone, to purchase those gun safes. And then next month, I should be able to provide you an update on how those have been distributed with our partners, JCMH, and also with the Colorado School of Mines. So another exciting project that has come to fruition for increasing safety and trying to prevent unintended harm due to firearms. So firearm safety, and also that safe storage for medication. I want to share this little anecdote about our regional health connector. So Cynthia Farrar works with 2 primary care practices in Jeffco who care for many families who speak either Russian or Vietnamese. And she recently connected those practices with 2 behavioral health practices who provide culturally relevant and linguistically appropriate services in these languages. Cynthia coordinated in-person meetings between both the primary care and the behavioral health providers, developing a warm handoff and workflow for referrals. Of note, about 1% of the county's population are not proficient in English, and statewide, 15.4% of people who speak a language other than English or Spanish reported 8 or more poor mental health days in the last 30 days. So these types of warm handoff connections are key for improving health in our communities. So as a regional health connector, she's really working to make those connections and those warm handoffs. So those are a few of the updates from family services. Next month, I'm hoping to be able to introduce you to some new staff members, some new nurses who will be coming on board. But I just want to take a moment to acknowledge Elise Lubell and thank her for the leadership she's shown at the health department, all the ways that she supported families in our Jeffco community, all the different programs she has spearheaded or overseen or supported or advocated for, and the many ways that she has advocated for equity, both internally among how staff are compensated and also for equity in our community to make sure that services are provided equitably to everyone. And for myself, she's been at the health department for longer than I have, which is, for me, it's been 15 years, and Elise has been here the entire time, kind of as a guiding light for me. And I'd really appreciate her, especially in these recent months where I've moved into a new leadership role. So to have Elise as a partner and a guide and a mentor for me in my current role, I just want to publicly acknowledge and thank you, Elise. The health department won't be the same without you. We will try and carry forward all of the amazing positive things that you have started and moved into, you know, from I think maybe one century to another. And I just want to say thank you. So I appreciate being here, and if anybody has any questions, I'm happy to answer.
Thank you, Carrie. Any questions for Carrie? All right, Christine.
Hello, I'm going to share my screen real fast because I think that will be a wonderful summary of what the EPID division is currently accomplishing. So we have started sharing a situation report that speaks to all of the infectious diseases and events that we are monitoring across the community, both county, state, region, nation. So each level or each event has a certain level of activation. SARS-CoV-2 or COVID-19, we are at activation and operations. Cybersecurity, a very important event, both really for everyone, both in our homes and in our place of business. We are monitoring that. Highly pathogenic avian influenza. You should have heard Nikki mention that we shared that information with our community members and those who may have backyard flocks and our agriculture partners. We are in a state of monitoring for this particular infectious disease. Monkeypox, there are 4 confirmed cases in the state of Colorado. We are continuing to monitor that situation, and we continue to share information with our health and medical partner through the Health Alert Network. Pediatric hepatitis, we are in a state of awareness. So this is sort of our lowest level. We know that it is out there. We are monitoring it mostly CDC level data, but we have had a little bit of involvement in Jefferson County, helping the state of Colorado and the CDC investigate a handful of these pediatric cases of unknown etiology. So this we've started producing these weekly for our staff. We are hopeful that this is helping share information in a way that keeps people informed. One of our after action items from our initial COVID response was that it would have been good to know. And so this is the improvement item that has come out of that comment. It would have been good to know. We are starting to share information about what we're watching, what we're keeping an eye on. The other update I would like to share is that I believe you've heard me talk about our infant and young child feeding in emergencies program. This program is so greatly spearheaded by Allison Wilson. I believe she will be coming later in a couple months to present more on the program, but I am super pleased to announce that we are sharing our information and moving that program into the Medical Reserve Corps, the Rocky Mountain Medical Reserve Corps. So we are moving our volunteers into the Rocky Mountain Medical Reserve Corps, where the whole of our community will have an opportunity to volunteer for this particular program to receive training. Right now, our training has been transcreated into the Spanish language. I am very excited that we can announce that and really lead the way in appropriate and inclusive volunteer inclusion. We are very excited that this is happening and that the Rocky Mountain Medical Reserve Corps is so forward-leaning that they are willing to house volunteer opportunities for all of our community members to help support response to any disaster, including one where we need to support infant and young child feeding. The last update I have is the EPID team had an opportunity to meet in person, and we were able to share our public health why. This very large, it's on your screen, but this very large image is currently in Mount Bierstadt at the Parfait building. So for our public health staff who are in the Parfait building, please feel free to stop by and take a peek at why our EPID team, really a lot of the newest members of Jefferson County Public Health are here, why they continue to support public health and our responses, why they are passionate about the work that they are doing. I will make sure that Lindsay has a copy of this and can share this with the board, but I'm very thankful for the EPID team. I'm very thankful for their heart, for their willingness to share their stories and to share their why. But as you look across this, there is continual mention of community and flexibility and family and support and really being the backbone of community health. And I'm very thankful for the team for sharing and for having this really passion for the work that we do. So that is the update from our Emergency Preparedness and Infectious Disease Division. I am very excited to have Health Communications join our team starting in July. I'm excited to learn and grow in that subject matter expertise, and I hope that I can do Elise proud with leadership of that particular group.
Thank you, Christine. Anyone have questions for Christine?
And Dakota says hi.
All right, we're at staff comments on the agenda. Any staff have comments to share with the board or the public? Board of Health comments, any board comments? Kimberly.
I have to unmute. I thought it was my own dog, so I was listening to the camera I have on her. So I'm glad it was Christine's and not mine. Thanks, Lane. Lindsay, can you share my PowerPoint? This is just, I just wanted to update the board and the staff on a really amazing opportunity that Hilda and I actually had the opportunity to do this past week. So Hilda and I joined John Vickery and the environmental health group on a road trip to understand better the on-site wastewater issues that are facing our county, and to get an opportunity really to understand more about what environmental services is doing. So Hilda, I'm gonna also watch your mute if you want to add stuff as we go along. So next slide, Lindsay. So our journey was a half a day, starting at the Jefferson County Public Health Building. You can go to the next slide, Lindsay. And we were ushered into the waiting room there so that Hilda and I could have an opportunity to really learn something new. And I don't want to speak for Hilda, but I will tell you, I learned a lot new. And so we had the opportunity to ride with John to 3 different sites to show us what he was doing that day. You can go to the next slide. We started the morning off really with John and his team, Mitch and John and Katie and others who were getting ready to leave for the day. 2 individuals were giddy because they were going to a children's camp to do, I guess, an annual evaluation. I don't know if John's on, or Hilda, if I'm misrepresenting this, help me out here, or Jim. And it was just so fun for me as a board member to see the excitement of these 2 individuals who were going, and it was a hot day that day, and to go up to this camp. But what was even more heartwarming to me were the other staff members who had done it previously were coming to tell them how wonderful this day was going to be for them. And it was unexpected. And again, if you decide you're going to learn something and you keep your ears open, you will learn something. And I've always heard the pride and the excitement of, especially from our leadership team as they're reporting about their teams, but to have the opportunity to see and experience that was really amazing. Hilda, do you want to add anything before I show them the pictures you took?
Oh my goodness, Kimberly, this is wonderful. Yes, I totally agree with everything you just said. It was a really neat experience, and it just proves the thing that I have felt for the last couple months, how much people love their job and how much they love to care for the people they are working with. So yeah, it was really neat experience.
Yeah, and Hilda asked John a question that part of his answer was his sharing how much this job that he has held and now will be leaving for, as Jim said, greener pastures, has been his favorite job of his career. And when Hilda asked him to expand on that, it was great to hear the aspects of meeting the public, being that advocate for public health. One of the situations that Mitch and John spoke about that morning with other team members was a very complicated situation where there were differing opinions about what had happened with the situation involving public health. And so John sharing that and his team sharing that it's as much facilitation, communication facilitation, and advocacy. We got the opportunity to actually see that. Next slide. So we started off, and as I said, we had 3 opportunities to go up into the mountains. And this first one was at Lookout Mountain. This was a home that had, I believe, a failed system that needed to be replaced. And we were allowed to actually trudge up the drive and walk and see. For me, I'm not going to speak for Hilda, but for me, it was the first time ever to see a septic tank system. And so we were there as a final system inspection, and John walked us through each of the things that had to be in place, and also really demonstrated this accountability, because you'll see here on the third picture on the to the right, where Hilda's taken the picture, John measuring or showing the filter. There's a green lid towards the front of that picture, and John was supposed to sign off that day that the inspection had gone forward. But again, he took a minute to explain to us that he really couldn't sign that off because the screws that were supposed to be in place on that green disc were not screwed down. And it wasn't a violation or anything. It was just that was sort of the process of where they were at in getting this finalized to fill in. And so he explained the process again, by which he would simply let them know, hey, take a picture once the screws are down and send it to me so that I know that it's completely done and completely safe. So again, it was just a really awesome opportunity to see him working with the engineer. And then the homeowner also came out during this process to talk with John a little bit too. Mm-hmm. Next slide. So this, go ahead, Hilda.
Mm-hmm. I would like to add one comment that I thought it was really important for from this process that we went through of inspection. One of the things that John said for me was what simplifies or gives a give example of their character of the people that work in the department is he felt like he was the ears and eyes of the homeowners, that he needed to make sure they were receiving the quality of work from the contractors, and they were the people that they trust us. I mean, the homeowners trust us that we're going to make sure that everything is done correctly so they can feel safe and secure with their systems. And so for me, that was a very important topic, that he cared for his work to make sure that the customer, the homeowner, has a good service and is protected. So I thought that was really important.
Absolutely. Thank you. Yeah, absolutely. The second place we went to was up in Bergen Park to a home that's being built up there that had all the permits and licenses and everything that they're supposed to, but due to some issues in the building of that home, one of the, I believe it was permits, had expired. So John needed to go out and just remeasure and do some things to make certain the setbacks were correct and all of that. And for me, it was just fascinating to see the biggest, largest tape measure roll I've ever seen in my life. And I think Hilda asked, how big is that? And he said, this is 300 feet. And so he actually let me measure from one of the sticks to this wall that you see. And the well is actually beyond where those trees are. And so it was more like 400 feet between the well and the field. And he said, you know what, here's 200 feet to the wall. And so we don't need to kind of trudge up the hill and go see up there. So it was, again, helpful to me to understand the words that we speak all the time in our variances when they're talking about 200 feet setback or an acre or whatever, to actually now see what they are out there doing. We had a beautiful day to be out there, but Hilda also mentioned to John, this must be really difficult in the winter when there's been snow and trying to find all these markers and everything that you have to make. So I was just really happy. It was warm and beautiful for our trip. Next picture, or next slide. So our last place we went up was up, I can't remember now. I think it was still in, was it Lookout Mountain? I can't remember. It was up in the mountains somewhere. And this again was a system that had failed, and we were able to see another TN1, which you're seeing in these pictures. And John was able to kind of explain to us in the upper picture, the field is back kind of in that light green area. He wanted us to see how they destroy and fill in the system that is now been decommissioned. And again, very lovely homeowner came out and spoke volumes for Seamus, I believe was his name, Seamus, the engineer who's there. And then down in the lower left-hand corner was his little guard dog, Lucy, who I really thought maybe we might have a health department thing because the dog barked a lot and I wasn't certain he wasn't going to attack me. Just kidding. The dog was wonderful. So we had this wonderful afternoon or day out with John, again, allowing two board members to really see the work that the public health department employees do. And I'm looking forward to possibly having a day or half a day with some of the other departments. I'd love to see what the Wic program thing is. I'd love to see the communications group, etc. So last slide, Lindsay. So we just want to give a huge thank you to John. What I really left driving away with was an appreciation for his willingness to let Hilda and I go with him, because there was so much work to do that day. And I left the office in the morning understanding how much work this small team needed to get done that day. And to have John dedicate those 5 hours to us and teach us is really, really impressive. So all the best, John, to your next adventure. And Hilda, we'll have to see where we go next.
I'm back. I'm ready. Thank you, Kim. Thank you so much for this presentation. That was a nice surprise.
All of the board is welcome anytime to request a visit, a site visit, do a restaurant inspection, go to a childcare, visit a WIC clinic. You're all welcome anytime. Just please don't hesitate to reach out to us.
Thanks, Jim, because I can't tell you how much how valuable this experience was to me as a board member. So thank you.
I think
that's all, Lane.
I think that will really help you all to be able to promote what we do and really make visible what the health department is all about. So we're more than willing to help you. Thank you.
Thanks, Kimberly, and I applaud you both for your efforts to go out there and learn that stuff. And again, John's going to be very missed. So sorry he's not on. So wish him well. Any other board comments?
So if I could express thanks to John too. I know he's not on, but if somebody, Jim, if you would pass it on for his work. And a huge thank you to Kimberly and Hilda for the photos and the report on the tour. That was really, really, really exciting. And I look forward to doing things like that myself. I don't think I could have handled this tour because I don't think I could have gone up those hills. But in a couple of months, I'll be up for it. So I do, in the public comment today, we heard some claims of statistics that I had not heard before. Like that anyone who's already had COVID is more vulnerable to various problems, and that people who've had reinfections get it more severely the second time. Things that I hadn't heard before. Also, that kids that get boosters are 2 times more likely to get COVID or something. And I just was scratching my head. And I would really like to ask the staff if they could do some fact checking for us on some of the statistics that we heard, and then share that information with us as board members. Because I know that community members often think that we're not paying attention to their concerns, and this is true both on both sides of the issue, in terms of the folks that are kind of pro-mask and pro taking precautions, and those who are anti-mask and have felt like our reactions were overreactions, you know, when we put public health measures in place. So when we hear things like this, I'd really like to hear what the data says and what the facts are. So if I could make that request, I would really appreciate some information. And other than that, thanks to all the staff for a great job, and that's enough from me.
All right, I think we're at the end of our comments, and the next item, we have an executive session. So if our legal folks want to assist us in moving in there, it looks like it's for legal advice concerning board communications.
Thank you. This is Carrie Markle, Deputy County Attorney for Jefferson County. May I have a motion to go into executive session pursuant to 24-6-4024B regarding legal advice concerning board communications?
So moved.
Second.
We have a motion and a second. Any discussion? All those in favor, say aye.
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 Any opposed? Any abstaining? All right, we will enter into executive session. And then when we come back, we will be adjourning. So thank you all for joining the board meeting this evening.
Thank you.
Board members, you should have the link in your emails. Thanks.
All right, we are now 6:09. We have left executive session and rejoined our Board of Health meeting. And having no further items to come before the board, I will adjourn our meeting. Have a good evening, all. Thank you.
Thanks, Lane.
Good night.
Good night.
Bye. Good night.